Welcome back to TV5 News at 9. Thyroid cancer is the 12th most common cancer in the U.S. And if healthcare providers can find it early enough, it can be treated with a positive outcome. Joining us this morning to discuss the risk factors and surgical options, our endocrine surgeon, Dr. Christina Mazer from CMU Health. Thanks for being here.
Thank you, Lauren.
So can you start by just explaining your role as an endocrine surgeon and what that typically involves?
So typically patients come to us with a new growth in their neck, a new lump, a new nodule that's found, and sometimes there's a biopsy that indicates that something malignant may be present there. My role as an endocrine surgeon is to help remove that cancer and get them on the pathway toward a cure.
And what are some of the most common types of endocrine disorders that might require surgical treatment?
So in addition to thyroid cancer, we have disorders that are benign. So thyroid nodules can be benign and not cancer. There can be functional abnormalities in the thyroid. The thyroid controls metabolism, everything from how your hair grows to how your toenails grow and everything in between. So sometimes that could not work so well and we need to address that. Also, there are other organs right beside the thyroid called the parathyroid glands that sometimes require treatment, and that's a different type of situation that is more involved with calcium metabolism. So there's a few different things that we might encounter.
So when it comes to thyroid cancer, should we be getting tested or screened for this pretty regularly? What does that look like?
Typically, it's your doctor doing an examination of your neck, and a lot of times you can feel something abnormal in the neck. Sometimes patients identify that themselves. If they're just touching their neck, putting on lotion, those types of things, you can identify it, but typically it's a doctor doing an examination.
And what are the signs or symptoms people should be aware of and that might indicate a problem with their endocrine system?
Sometimes it's, like I mentioned, just feeling something abnormal there. Occasionally you feel it from the inside, so maybe a little bit of extra pressure when you swallow, maybe food gets stuck, that type of thing might be slowly getting a little bit worse for you. Occasionally, if there's, like I mentioned, a functional disorder, you might feel some odd symptoms. You may feel anxious, racing heart rate, a little bit too hot all the time, or the opposite. There may be changes in your weight, changes in your hair, skin, or nails. Those types of things might be slowly creeping up.
So lots of different things people can look out for, it sounds like. How do you and the CMU Health team help patients navigate a difficult diagnosis of thyroid cancer or other endocrine concerns?
Yeah, so we have a large team at CMU Health, beginning with primary care providers, our medical endocrine colleagues, and then us in the surgery office. We work dynamically as a team to get patients in, address their concerns. Most of the time we can fit a patient in for evaluation within a week or two, sometimes sooner if there's a drastic concern. We then help by arranging the proper diagnostic testing, and then through the help of our partner hospitals have been able to really streamline the care to get the patient into the operating room if that's what it calls for, or additional treatment.
So for anyone watching this right now who might be going through something like this, what can your patients expect from surgery to the recovery process?
So once we make a diagnosis and plan for the surgery is usually done at one of the hospitals. Typically it's either outpatient or a very short hospital stay, and the road to recovery from thyroid surgery is fairly quick. Usually patients feel better within a few days, just maybe a week or two off work. So it's a pretty easy surgery to have and recover from.
Well, it's definitely positive news that people want to hear. Christina, thank you again so much for being here. We appreciate it.
Thank you for the time.
Of course. And you can always find more information on today's topic on our website. Just go to the hot link section of WNEM.com.